Hi, good morning Sharon. My name is Mihira. I'm your invigilator for the OET-speaking session on the 31st of August 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Sharon Wayne.
And could you confirm your candidate number?
My candidate number is 228811100.
All right, are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Okay. Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
How do you ensure patient confidentiality and privacy in your daily nursing practice?
Patient confidentiality is of utmost importance in nursing. I strictly adhere to regulations by only sharing patient information on a need-to-know basis. I ensure that patient records are securely stored, and I always speak discreetly when discussing patient matters. Trust and confidentiality are essential in building strong nurse-patient relationships.
Can you describe your experience in handling difficult or uncooperative patients?
Dealing with challenging patients is part of nursing. I approach such situations with patience and empathy. In a recent case, I had a patient who was anxious and uncooperative due to fear. I took the time to listen to their concerns, offered reassurance, and involved them in their care decisions. Through communication and understanding, we were able to establish trust, and the patient's cooperation improved.
How do you prioritize your tasks when you have multiple patients with varying needs?
Prioritization is key in nursing. I use a systematic approach by assessing the acuity and urgency of each patient's condition. Critical cases are addressed first, followed by those requiring medication administration or specific treatments. I also delegate tasks when appropriate to ensure all patients receive timely and quality care.
Can you share an example of a time when you advocated for a patient's needs or rights?
Certainly, I once advocated for a patient who was not receiving proper pain management. After assessing the situation, I discussed the issue with the medical team and presented evidence of the patient's discomfort. As a result, we adjusted the pain management plan, leading to improved comfort for the patient and better overall care.
How do you handle a situation where you make a mistake in patient care?
Transparency and accountability are essential when errors occur. If I make a mistake, I immediately report it to my supervisor and the appropriate healthcare providers. I also communicate the error to the patient or their family, taking responsibility and offering a sincere apology. I view mistakes as opportunities for growth and strive to learn from them to prevent similar occurrences in the future.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hello, good morning. I'm Nurse Sharon Wayne, and I'll be attending to you today. What can I do for you?
Hi, good morning, Nurse Sharon. I'm here to inquire about the flu vaccination. I heard it's important to get it every year.
That's right. The flu vaccination can help protect you from getting sick with the flu virus, which can cause serious complications and even death. It can also reduce the spread of the virus to others. I appreciate your willingness to take the flu vaccination.
Thank you, Nurse Sharon. I want to stay healthy and prevent others from getting sick too.
That's very considerate of you. Now, before we proceed with the vaccination, I need to collect some information from you. What is your full name and date of birth?
My name is Mihira. I was born on the 15th of June 1975.
Thank you, Mihira. Are you currently taking any medications?
No, I'm not on any long-term medication.
Okay. And how are you feeling today?
Well, actually, I do have a bit of a cold and a slight fever. I've been feeling chilly and tired for the past few days.
I'm sorry to hear that. It sounds like you may have a viral infection. Have you taken any medication for your symptoms?
No, I haven't. I thought it would go away on its own.
Well, in that case, I would recommend that you take some over-the-counter medication to help relieve your symptoms. You can take paracetamol for your fever and pain, and an antihistamine for your runny nose and sneezing. Make sure you follow the dosage instructions on the label, and drink plenty of fluids.
Thank you for the advice, nurse. How often should I take these medications?
You can take paracetamol every 4 to 6 hours as needed, but not more than 4 times a day. You can take an antihistamine once or twice a day, depending on the strength of the tablet.
Okay, I understand. And when can I get the flu vaccination?
Well, unfortunately, due to your current illness, it's advisable to delay the flu vaccination by 2 weeks. This is because your immune system may not respond well to the vaccine if you are already sick. There is also a risk of side effects or adverse reactions if you get vaccinated while having a fever.
Oh, no. Does that mean I'm more likely to catch the flu in these 2 weeks?
Not necessarily. The flu vaccine is not 100% effective in preventing the flu, but it can reduce the severity and duration of the illness if you do get infected. However, there are some general tips that you can follow to stay healthy during the flu season. For example, regularly washing your hands with soap and water, or using an alcohol-based hand sanitizer, can prevent virus transmission from contaminated surfaces. Avoiding touching your face, especially your eyes, nose, and mouth, reduces the risk of infection. Employ proper cough and sneeze etiquette by covering your mouth and nose with a tissue or your elbow. Dispose of used tissues in a bin and wash your hands afterward. Limit close contact with individuals displaying flu-like symptoms, and stay home if you fall ill to prevent further transmission. Maintaining a balanced diet, staying well hydrated, getting adequate sleep, and engaging in regular exercise can bolster your immune system. These practices, combined with vaccination, significantly reduce your susceptibility to the flu and enhance overall well-being during the flu season.
Thank you for the tips, nurse. They are very helpful.
You're welcome, Mihira. I hope you feel better soon.
Thank you very much.
Now, let's schedule a follow-up appointment for your flu vaccination in 2 weeks' time. How about the first Monday of next month?
That sounds fine to me.
All right then, I'll book that for you. Please remember to bring your ID card and any relevant medical records with you when you come for your appointment.
Okay, I will.
Is there anything else I can help you with today?
No, that's all for now. Thank you for your assistance, nurse.
You're very welcome, Mihira. It was nice talking to you today. Take care and see you soon.
Thank you, nurse. Bye for now. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.